When we talk about chronic disease, the definition is something that persists for more than 3 months and has no cure. That's why it's chronic. Yeah, there's no cure, but to some instances, you might find, we don't like giving hope, but when it comes to maybe diabetes or hypertension, sometimes you might live right, and you find that we taper down the dosage, up to a point where you can just live a healthy, you just do lifestyle modification and you might be off the medication, but it's not a guarantee. So long as you're diagnosed, there's also the effect of lifestyle changes. A lot will change in your life for you to fit into the new you. Now that is so there's a lot that you have to adjust. But in terms of cure, because that is something every patient asks. So you've told me that I have hypertension or diabetes. When am I going to stop this medication? No, there's no time you're gonna stop. But if it happens, let it be under the doctor's advice. Don't just wake up and say, I'm feeling okay, now I don't have to take the drugs. Yeah.
I understand that can be so emotionally draining for these patients. Do you perhaps take them through, say, psychological mentorship, help? Say, after you tell somebody they came just thinking they have malaria, but now you tell them they have diabetes or maybe hypertension. What available resources do you have for them to just help them live a normal life and not feel stigmatized or, that feel like they're dying?
So that is, in terms of the healthcare ecosystem, that is a shift that we're seeing. There's a change in terms of how do we manage these patients. Because Kitambo was like, you have hypertension, shika hizi dawa enda umeze. I've not even told you what is hypertension, what are the complications, what are you expecting, what are the changes that you're expecting. So in that ecosystem, in the healthcare ecosystem, we're bringing about a program that is very unique, and that's what we're doing with Myer Hospital. It's called the Chronic Care Management Program, that ensures that in as much as you have that diagnosis, we are taking care of you holistically, not only medication therapy. So when you're diagnosed, the first thing we do, it's so hard for you, even for me, for somebody to tell me that I have to take that pill in the morning or twice a day for me to stay alive. What am I expecting when I don't take that pill? What happens? So that is something very emotional, that now you have to change your lifestyle, you have to adjust your diet for this. So for us to take care of this patient holistically, under the chronic care management program, we are bringing in multi-sectoral approach for these patients. So from the GPs to the specialist, all the way to the nutritionist, because it's part and parcel of management. Psychosocial support is also important, because I want to be able to adjust emotionally that this is my new normal, this is what is going to happen moving forward. And also the physical aspect, because physical exercise and all that is part and parcel of that. So I know most hospitals have caught on to this, and they're setting it aside like a different program for those patients. That's to ensure that they are well taken care of, they're educated, because the first thing is education. Now I have diabetes. What is diabetes? What is my complication? What if I go low? What if I go high? What am I expected to do? What other changes do I need in my lifestyle to be able to fit into the new normal? So at Myer, we have a program for that, chronic care management, that ensures that the patient is taken care of holistically. Yeah.
I'm looking at the country's 5-year plan of NSDs that is running through 2026, and of course it aims to reduce the number of chronic illnesses, or the increasing number, by 2026. Do you see us getting to that point where we are talking less about chronic diseases being on the rise? Come next year, because the 5-year plan is ending next year.
Next year. There's still an increase, because the changes that are causing the increase are still constant. So it calls in, it's a call for action for public, private, NGOs to ensure that there's proper patient awareness. from, as I said, the annual checkup, the wellness, the camps, those are things that we're using to drive awareness that if I find you with a high, just slightly high, I have the responsibility to educate you that if you don't take care of this and this and this in terms of your lifestyle, in the next maybe 1 or 2 years, you'll be fully fledged dependent on medication. So there's still no increase. There's a lot of advocacy and awareness that is required for us to be able to bring the numbers down. But I'm sure because there's already an initiative, we're going to start seeing changes, but not at the moment. It might take time. Yeah.
Let's talk about caregivers as well. You know, usually we just talk about these patients who come in, they have diabetes, they have cancer, they're going home. But do you also offer, say, support, psychological support, advice for these caregivers on how they're going to handle these patients? Because we understand that chronic diseases are lifetime. They're going to be with these patients for life. Do you take them through a certain training?
So that is a shift in terms of how you treat a patient, because most of the time we focus on the patient alone. We don't look at other aspects and other parts of the patient, because yes, I'm diagnosed, I'm diabetic, but my family is also affected on the same. So how do I bring in the family, either the husband, the kids, to understand? So most of the clinics, most people are accompanied, but we are seeing that in extreme of ages. If they're elderly or if they're young, they come with their caregivers. But I think in the shift of the chronic care management programs, that is something that we're trying to bring together so that we ensure the family is aware what is required, how this patient will interact with them differently, how they're going to treat the patients, because also you don't want them to feel like now the whole family has to look and take care of me. They feel like a burden. But there's a way along the program you're able to bring in other people, explain to them how the patient is, how the condition is, how to take care of them even when they're at home. And also, most of